Now we are going to discuss about the clinical importance of ECG. There are few clinical importance which are very easy to pick up. Now since we have understood the basics, they are very easy to pick up and you can easily attempt all these MCQ questions. So first coming to the first discussion of a disease which is called as Wolff-Parkinson-White syndrome. Wolff-Parkinson-White syndrome. So what is the problem in this disorder? The primary problem in this disorder is that there is something called as an axillary connection. There are some additional fibers which is connecting the atrium to the ventricle. All of us know the only pathway for the atrium to go into the ventricle is to go through the AV node. But in this what happens is there are some abnormal fibers which is connecting the atria and the ventricle. So let's take an example. There is some connection, something like this. So what happens whenever the connection is like this? Then those will be the features of the Wolff-Parkinson-White syndrome. So first, this group of fibers, they have a special name also. They are called as bundle of Kent. They are called as bundle of Kent. So now we are going to find the ECG findings of this disease. So let's revise through our basics. So whenever any SA node is firing, what will happen? It will go to the AV node, then bundle of S, then Purkinje. So the fibers will pass through it. And what happens in the AV node? What happens in the AV node? There is an AV nodal delay. But right now what will happen? The fibers are firing everywhere. So whenever the fibers impulse reaches here, SA node impulse reaches there, they will directly conduct it. They will not wait for an AV nodal delay. So which duration will get shortened? Which is the duration which is responsible for AV nodal delay? It is the PR segment. Now our PR segment will not have to be there. Why? Because now this fibers will connect it directly without waiting for the AV nodal delay. So first event that happens is there will be a P wave. P wave will be fine, but the PR segment will be shortened because right now this bundle of Kent will reach the ventricles much earlier. So what will happen? They will reach the ventricle and they start to give up some of the fibers or impulses. Now the coming impulse from the AV node also will come and join. Now both of them are joining. Here some impulses have arrived first. Now they also will come and join. So what will happen? There will be a point something like this where there is a joining of the AV nodal fibers also. And finally the complex of OR wave will go like this. So this will be the finding in a case of Wolff-Parkinson-White syndrome. So let's write the speech features. So what has happened here? The first feature is the PR interval is shortening because it is not waiting for the AV nodal delay. PR interval shortens. Then what else has happened? Just look at the diagram. There is what has happened to the QRS? There is widening of QRS complex. So second feature is there is widening of QRS complex. So the QRS complex widens, widening of QRS. Then coming to the third feature, this wave, this upstroke where the merging happens, it has something called as a special name which is called as delta wave. Delta wave. So these are the three classical features of the Wolff-Parkinson-White syndrome. The full name is Wolff-Parkinson-White syndrome.